సో స్ట్రెస్ వల్ల ఈవెన్ బ్రెయిన్ స్ట్రోక్ కూడా వస్తుంది అనేది అది ఎంతవరకు నిజం?
And your heart or your blood vessels, they get slowly damaged.
ఇన్ ద మిడ్ నైట్ ఆర్ సమ్ మార్నింగ్ లేసినప్పుడు అన్నీ పట్టేసి ఉంటాయి, స్టిఫ్ నెక్ అయిపోతూ ఉంటుంది అండ్ స్పైన్ కూడా దెబ్బతింటూ ఉంటుంది. సో ఇట్లాంటివి ఏం జరుగుతుంది అసలు?
Quality of sleep, no, one very major factor is sleep apnea and snoring. Must have part.
Yeah.
So snoring causes, when you sleep at night, these lymphatic channels get activated and they clean the brain. So that has to be taken care by the patient themselves.
Hi, this is Dr. Manisa Reddy. Today we have Dr. ANIRUDH, interventional neurologist and stroke specialist. Let's welcome him. Thank you for joining us, sir.
Thank you.
How are you?
I'm good. How are you?
I'm good, thank you.
Yeah.
సో మీరు చెప్పండి, జనరల్గా స్ట్రెస్ వల్లనే ప్రతి ఒక్క డిసీజ్ వస్తుంది అని అంటుంటారు. సో స్ట్రెస్ వల్ల ఈవెన్ బ్రెయిన్ స్ట్రోక్ కూడా వస్తుంది అనేది విన్నాం, అది ఎంతవరకు నిజం?
So see, stress is basically manaki for many years you've been hearing stress wala idu vastundi adu vastundi, but there's always a missing link. People don't understand what exactly happens. So stress is how your body reacts to the external danger or situation. People have problems, they might be okay with it, they might take stress about it. So stress తీసుకున్నప్పుడు our body reacts. What we show outside, కోపం, irritation, frustration, shouting, that is outside manifestation. What happens inside is in multiple ways our body chemically, physically and mechanically, it affects different organs.
Okay.
So when, for example, if you are sitting next to a tiger or you are standing on a very high cliff, what happens?
We get
You
scared,
have
anxiety.
you get scared. That is what you see. What happens inside? Heart rate increases. You start sweating. Palpitations vastayi. You have a pain in your tummy, pain, all that. Just imagine that is the stress response. That's called the sympathetic drive.
Okay.
Fight or flight. Okay. So that is a response which is basically called stress in colloquial terms. So that happens when you have a danger.
True.
What happens if you go through this every day? If you are in an office where you have some situation where you don't like it, you're going through the same thing. You come home, you have issues, emotional issues, family issues, you go through the same thing. You have health problems. So this exact response, which is called stress response or sympathetic drive, if it goes on and on and on, just imagine you're having palpitations 8 hours a day. Every single day, 8 hours a day. Your heart will get tired.
True.
Your brain is on overdrive. You're overthinking. It's going on like a very fast machine, 24 hours. When you're sleeping, you're thinking. When you're relaxing, when you're eating, there's no relaxation at all. So that is stress, and this is how your brain and your heart or your blood vessels, they get slowly damaged.
Okay.
So what exactly happens is, first, because of stress, you have multiple chain events, effects. You have a high BP. You have high heart rate. You have release of cortisol. What does cortisol do? Cortisol increases glucose generation because you're in a fight or flight state. So in that you need more glucose to run or fight. So glucose increases. Insulin resistance increases. Your fat metabolism increases. Whatever you eat, it is not going to the right channels. More of it goes into abdominal fat. All this causes more of inflammation. So in multiple ways, stress is strangulating your system, which causes damage through high heart rate can cause heart attacks, high BP can cause strokes, it can cause blocks in your legs and leg swelling. Abdominal fat accumulation causes obesity.
True.
Abdominal fat is known for increasing inflammation. And when your body is chronically inflamed, what is inflammation? Inflammation is basically your blood vessels, your tissues are swollen, they're red, they're swollen. That is, and if you have a longer time period, itlane chaala రోజులు మనకి swelling ఉంటే, they get blocked. If there is swelling in the artery, inflammation artery, they get blocked. Brain or heart, wherever it is. Kidneys fail. Why kidneys fail? Because chronically there is inflammation of the arteries in the kidneys and slowly the kidney fails. So all this is called end organ damage.
Okay.
End organ damage is what actual results to the failure of the organ. Brain ante stroke, heart ante heart attack, kidney ante kidney failure, liver ante liver failure. All these are end organ damages. You have blindness, you have retinal artery damage, you have cataract. All these are end organ damages.
Okay.
So when you go through this system of stress and sympathetic overdrive for a long time, this is how your body gets damaged. So it is very important to recognize a problem or a danger, recognize that yes, there is a
Something.
trigger for stress, but it has to be managed. We have to be problem solvers, not problem thinkers.
Yeah.
Right? So solving is the issue. So you try to solve it with a cool mind. Give it some time. Sometimes you get a quick response, quick answer. Sometimes you don't. But if you don't get an answer, there's no point overthinking.
Accepting yourself.
Yes.
Is
So
better.
what exactly happens is, so everyone tells you, if I tell you, please reduce your stress, what will you go home and do? You stress about it
Definitely,
more, that
yeah.
I'm not able to reduce my stress. So that is not enough, that stress causes problems, you reduce it. That is not a good enough advice from any doctor or a psychiatrist or anyone, because how to do it is very important.
Yeah.
So when you understand that stress is how you respond, stress is not the external thing. వాళ్ళు నాకు స్ట్రెస్ ఇస్తున్నారని కాదు,
True.
వాళ్ళు నాకు స్ట్రెస్ ఇవ్వట్లేదు, మనం స్ట్రెస్ తీసుకుంటున్నాం.
తీసుకుంటున్నాం, yeah.
They are giving us a problem because they have their own thing. It is an interaction between people. So how you react to their interaction is how you decide whether
True,
you want
true.
to take a stress about it or you want to solve it coolly or you want to ignore it. Is your problem. So you have to look at it that way. Then you understand, this is a problem, I solve it today, I solve it tomorrow. I can't solve it, someone else will solve it. You find a solution, God, friend, teacher, parents. So you somehow you solve it. So focus on the solution of the problem rather than overthinking about it. So that is a very simple trick where you identify the problem, look for a solution and wait for it.
Even I realized it very late actually. మనం ఏం చేయలేము, but for what we have, you have to accept either, as you said, spiritual gana, hobbies through, like you find some friend.
Yeah, definitely.
True. అయితే ఇప్పుడు ఈ స్ట్రెస్ అన్ని ఆర్గన్స్తో పాటు ఈవెన్ దాని ఎఫెక్ట్ స్పైన్ మీద కూడా ఉందంటారా?
Spine is it's a mechanical part of the body, right? So what happens when you stress? When you stress or you overthink, many times you must have seen, you'll be sitting and watching phone or doing some work, studying or laptop, some work you're doing. Dantlo, after some time, if you are so engrossed in that work, when you get up, you have this thing.
True.
You must have seen so many videos,
True.
even AI videos where if a person under stress, and the first thing they show is this. What is this? Why are you doing this? Because you were so engrossed in that work that you had your body stiff. Your head muscles stiff, neck muscles stiff, back muscles stiff, and you're in that position for a long time.
True.
If I talk to you right now and ask you to stand 5 minutes like this, you cannot do because it will pain. But if you're engrossed in some work which is, like you're really tensed or you have to get it done right now, then you
Don't
forget
feel that
You
pain.
don't feel that. But when you get up, you start feeling that.
Yeah.
So that muscle spasm or muscle stiffness, if that goes on for a long time, either through this improper position during work, IT people go to work.
Hyderabad
lo, they sit for long hours, 6 hours,
Desk
8
job
hours,
and all.
desk job. They're doing their work, and once they get into the work, they don't know whether their chair is high or low, whether their neck support is there, back support is there. But when they get up in the evening, they have a pain. And if this goes on, your spine shape changes. So many times you must have seen, X-ray spine or X-ray back change kunte, straightening of spine and rasuntundi. What does straightening of spine mean?
Yeah, please.
So we have a normal curvature of cervical spine and a lower spine. Normal curvature untundi. That is healthy.
Okay.
But if your neck is under stress because of any reason, in that your muscles become stiff and make it straight. So that is when you have cervical straightening or a lower back straightening. So that is an indication that your body or your spine is under chronic stress, either because of your improper sleeping position at night or improper sitting during work or long hours of neck bending while chadukuntunnappudu phone chustunappudu. So this is how, and as this progresses, so once your spine shape changes, your bone to bone, so you have vertebra ki madhyo disc untundi. ఆ బోన్కి షేప్ చేంజ్ అయినప్పుడు ద డిస్క్ గెట్స్ అండర్ స్ట్రెస్, కమ్స్ అండర్ స్ట్రెస్. సో ఒక the body is made in such a way that ఈ యాంగిల్లో ఒక బోన్ ఉంటే the disc will take good support. ఆ చేంజ్ అయిపోతే the disc comes under stress, then there's a tear in the disc comes out, then you call it slip disc.
Okay.
The major reason for slip disc, which was used to be common in older age because of bone getting soft and అరిగిపోవటం అంటారు, అరిగిపోయి degeneration అయ్యి disc బయటకు వచ్చేసింది. But younger people are also having it in unusual positions. Why? Because of this abnormal posture while sitting.
Okay.
We don't exercise, we don't sit on the floor, we don't bend down. When was the last time you properly bent and picked up something, or you properly fully bent your knees?
These days I'm doing it regularly
now,
because it's seeing all
exactly. So before, like, we're all
before never.
we're sitting here, morning we got up, we had breakfast on the dining table, we're sitting on this podcast like this. You go for your office, you sit on a
This
chair.
way, దీంట్లోనే.
Lunch, you sit on a table. Dinner, you sit on a table. Car, you're sitting. Nowhere are you bending your joints fully.
Knees or you're sitting
So whole
fully.
day, so unless you consciously try to do an exercise or yoga or sit, you don't do it.
True.
So that's how your body's shape changes. Because the change in shape, the mechanics or the dynamics between the structure changes, and then things go wrong. Disc comes out, disc compresses your nerve, the muscle goes into spasm, you have chronic back pain. If that worsens further, you will have neurological problems because of nerve compression and all.
True. Stress related neurological problems ఈ ఐటీ ఫీల్డ్లో ఎక్కువ చూస్తున్నాం.
Yes.
ద సేమ్ అంటారా, అంటే దేని గురించి పట్టించుకోకుండా
Yeah, because they are like what many patients who come to ROP either with headache or back pain or this thing, when they ask what is your schedule, they're like working 12 hours, 9 hours, 10 hours a day sitting on a computer. And some of them have such a wrong timing, 2 to 11,
off
4
timing
to
lo anta.
4 something, in a very odd timings. So neither are they sitting healthy during the day when they're working, and when it's time to sleep and take rest, then also they are not doing that.
True.
So whole day, every day for years and years together, if you are, while you are awake and padukutnappudu, both times your body under stress.
True.
So what do you expect? When will your body get, you'll be like, in for work and career and this thing, we are abusing our body.
ట్రూ. అయితే వీళ్ళు ఏం చేస్తుంటారంటే 5 గంటలు పడుకుంటున్నాం కదా అని అంటారు. ఈజ్ ఇట్ రియలీ సఫిషియంట్ మన బాడీకి ఒక 5 గంటలు పడుకుంటే సరిపోతుందా? అండ్ ఇంకొందరు ఇంకేం చేస్తుంటారు అంటే వీక్ అంతా కష్టపడేసి వీకెండ్లో ఏదో ఒక రోజు ఆర్ 2 days దే టేక్ రెస్ట్, ఫుల్ రెస్ట్ తీసుకుంటారు. ఇట్ ఈస్ లైక్ ఆ డెప్ని అంతా పే బ్యాక్ చేస్తున్నట్టుగా దే ఫీల్ ఇట్. సో ఇస్ ఇట్ సేఫ్ డూయింగ్ దాట్?
See, I don't think that's a good idea, because there are multiple practical issues with that. First of all, if your whole week you are not sleeping properly, manaki Monday nunchi modalaitundi, by Wednesday your body is already exhausted. You're exhausted. You're already by Wednesday you're waiting for Friday and Saturday. That itself is the first indication that this is not a correct system. Second, if you take rest, a very practical thing which happens to me also, you go on a Sunday afternoon and you sleep 4 hours because you did not sleep. What happens? You don't sleep on Sunday night.
True.
You wake up Monday morning without lack of sleep.
True.
You again wake up Monday like this. So, it is a vicious cycle. This happens to everyone. It happens to me also. Now, and you're so tired that you think that you deserve a Sunday sleep, and you're starting your week with lack of sleep.
True.
And then by Wednesday you're exhausted. So, what happens is, in this system, the only time you are active, cognitively active, happy and productive is on Saturday, Sundays, when you are not working.
True.
Because that is the time you have taken rest and you're active. But when it comes to the working days, you're down. You're tired, you're sleepy, you're groggy, you're irritable, you're not fully functional, productive. So it is obviously not a good system. So there has to be a way of getting good sleep at night in correct timing. See, you cannot pull your body's clock.
Definitely.
You cannot say that I slept 5 hours in the afternoon, so I will stay up a whole night. That's not going to last for
it
too
shows
long.
on your body, it shows on your face, everywhere.
Your face becomes tired, you become dull, you cannot function. See, you're working to be productive, to have a career and all, but everything else which you do is making it less productive, less effective. There's no point. So I always tell these people, see, everyone wants to work. Some people are workaholic. You like your work, you don't like your work, that's a different point, but you have to work. You have to work, right? So find a way where you're most effective. You have to find, and the most important is effective and sustainable. You cannot have a solution or a schedule which is not sustainable over 20 years.
True.
What will happen 6 years, 7 years down the line? You are roaming around with abdominal fat, headache, migraines,
True.
neck pain, back pain. Every part of your body is paining, outside, inside, everywhere. There's no point. So you have to find a sustainable, and all of us are, it's not impossible.
True.
Everyone is educated,
Yeah.
everyone is intelligent enough to manage their time in such a way that you're more productive during the working hours rather than the other way around.
యా అయితే నేను గమనించింది కూడా ఏంటంటే దీస్ డేస్ కొంచెం ముందు కన్నా బెటర్ ఉంది.
అవును.
ఇఫ్ యూ సీ యువర్ పేషెంట్స్ ఆల్సో దే ఆర్ అండర్స్టాండింగ్ ఎట్లా ఉంటుంది హెల్త్ పోయిందంటే అన్నీ పోతాయి.
అవును, దట్స్ ఇట్.
ఎవ్రీథింగ్ యూ ఎర్న్ హ్యావ్ టు బీ స్పెంట్ ఆన్ ది హాస్పిటల్స్ ఆన్ ది.
Yes.
సో అట్లాంటప్పుడు వాట్ ఐ అబ్జర్వ్డ్ వాజ్ మీరు అన్నట్టు ప్రొడక్టివ్గా ఉండాలి అనేసి వర్కింగ్ 5 days ఇస్ బెటర్. తర్వాత మిగతా 2 days యూ నీడ్ టు టేక్ రెస్ట్ ఆర్ సంథింగ్ రీసెట్. బాడీ నీడ్స్ రీసెట్ ఆల్సో. ఈవెన్ వెన్ ఐ వాజ్ టాకింగ్ విత్ మై ట్రైనర్, ఈవెన్ మనం ట్రైన్ చేసే వాళ్ళకు కూడా ఎవ్రీబడి నీడ్స్ దట్ రీసెట్ టైం.
ఎగ్జాక్ట్లీ.
ఫోన్ చూసుకుంటా పడుకోవడం అందరికీ అలవాటు. సమ్ టైమ్స్ ఎవ్రీ వన్ ఆఫీస్ డూ దట్. సో అట్లాంటి టైంలో వీ డజన్ నో. మీరు అన్నట్టు స్ట్రెస్ ఉన్నప్పుడు నీకు నొప్పి తెలియదు, బట్ లేటర్ వెన్ యూ వేకప్ ఇన్ ద మిడ్ నైట్ ఆర్ సమ్ మార్నింగ్ లేసినప్పుడు అన్నీ బట్టేసి ఉంటాయి. స్టిఫ్ నెక్ అయిపోతూ ఉంటుంది అండ్ స్పైన్ కూడా దెబ్బతింటూ ఉంటుంది. సో ఇట్లాంటివి ఏం జరుగుతుంది అసలు, అండ్ హౌ డస్ న్యూరాన్స్ రిపేర్ మనం పడుకున్నప్పుడు?
సో వన్ థింగ్ ఇస్ సంథింగ్ కాల్డ్ స్లీప్ హైజీన్. స్లీప్ హైజీన్ అంటే how do you sleep properly?
Okay.
Properly and what you do before sleeping, during sleeping, when you get up. All this is called sleep hygiene. So any of these factors get disturbed, you will not get good sleep.
True.
And the whole purpose of sleep gets defeated. And you will not be fresh in the morning.
Yeah.
So many times we get up, we sleep 8 hours in the night, but morning when we get up, you feel heavy, headache ఉంటుంది, అలసిపోయి ఉంటుంది. You feel that నిద్ర సరిపోలేదు, even though you slept 8 hours or 9 hours. So that is because something went wrong in these multiple factors. Okay. So first thing is phone. So before you sleep, the whole purpose of sleeping is relaxation of your mind. Stop thinking about what happened throughout the day, and your body or your mind gets repaired, or what you call relaxes, or gets ready for the next day. It's like a hotel cleaning its kitchen in the night.
Okay, we have
Right?
to do that. True.
Yeah. So if you don't allow, if you tell a hotel that I will eat till 1 o'clock, 2 o'clock, next day morning you will not get your good breakfast.
True.
So everything needs a time at night to clean. Cleaning means getting cleaning and then preparing for the next day.
Okay.
Right. So if you watch phone or do any argument, phone, TV, or any work also, what happens is first of all, because of light, when your light enters your eye, your melatonin, something called melatonin, it's an hormone which is secreted by the brain at night to promote sleep.
Okay.
It puts you to sleep. It's like a glass of warm milk. Okay. So that is your body gives to you to sleep. When you put light into your eye at that time, 11 o'clock, 10 o'clock, that melatonin gets suppressed. And then your body gets a ulta signal that it's not the time to sleep, it is
You
to
have
be
to,
active. You have to be active. And then you don't get good sleep.
Okay.
So that increases your sleep onset time. So when you go to sleep after watching phone for half an hour, 1 hour, the time it takes for you to sleep is much longer because your brain is active. There is simple biological chemical stuff. Second is when you watch anything or do anything on the phone, your brain becomes active.
True.
You start thinking someone said something, usne kuch bola, usne kuch aisa hua, something comes up and then your machine starts again. It's like someone switched off the fan. This fan is just about to close and you again switch it on. So that fan will never stop. So you have to gradually reduce your engagement with the previous activities, day activities, and prepare for sleeping. Only then your body will go into a smooth slope of sleep where the onset is good, the duration of sleep is good. Second, when you overthink, again the cortisol also kicks in, and then again makes your body active.
True.
And when you're sleeping in the night, your metabolism, your glucose becomes high. Whatever you had for dinner, that is not absorbed properly. So all these things become a problem if you have some kind of engagement with the external world before sleeping. unless you have a small book to read which calms you down, not again something which reading some
What happens next?
some scary novel where you again you're getting dreams about that novel in the night. There's no
Okay.
point. So many times you'll see that if you have some very emotionally engaging topic either in the phone or with your family before sleeping, you might get the same thing in your dream.
True.
So that means that topic is not over, that movie is not over, it's still going on in your brain.
Yeah.
So you have to switch off that movie before you sleep, right? This is what you do before sleeping. Second is how you sleep. So there are many people who don't who have this issue that manaki neck pain undi తగ్గట్లేదు, మళ్ళీ వస్తుంటుంది, ఎప్పుడు నొప్పి ఉంటుంది, కొంచెం కూడా పొద్దున్న లేచి ఇట్లన్నా కూడా పట్టుకుంటుంది. దిస్ ఆర్ వెరీ కామన్ కంప్లైంట్స్. దట్స్ బికాస్ ద వే యూ స్లీప్ ఈజ్ నాట్ గుడ్.
Okay.
పొజిషన్ మీ పిల్లో బాగాలేదు. సో ఫ్యూ డేస్ బ్యాక్ ఐ వాస్ టాకింగ్ వెదర్ యువర్ పిల్లో ఈజ్ దేర్ టు గివ్ యూ ప్లెజర్ ఆర్ పెయిన్. So if your pillow is not giving support to your head properly, then during first few hours you'll be uncomfortable, you'll toss and turn, but at some point you'll sleep off, right? నిద్ర వచ్చేస్తుంది, నిద్రలో పడుకుంటారు, బట్ ఆ నెక్ అబ్నార్మల్ పొజిషన్లో బెంట్ అయి ఉంటుంది. బై మార్నింగ్
You have that.
you have a stiff neck. That means your pillow was not correct.
Okay.
So the first question I ask whoever comes with a neck pain or lower back pain is, when a pillow change అయిందా, mattress change అయిందా, did you change your house, or
Okay.
you change your cities, వేరే చోట పడుకుంటున్నారా. వెరీ కామన్లీ తెలిసి ఇప్పుడే మ్యాట్రెస్ చేంజ్ అయింది, ఆర్ వేరే చోట పడుకున్నా, హోటల్లో పడుకో, సంథింగ్. సో వెన్ ఎవర్ దట్ చేంజ్ ఇన్ యువర్ స్లీపింగ్ పోస్చర్ కమ్స్. అదర్ థింగ్ ఇస్ పీపుల్ హూ హ్యావ్ కిడ్స్, young mothers, they sleep with their kids like this.
True.
And then they say ఇక్కడ నొప్పి వస్తుంది. The first thing as a పిల్లలు ఉన్నారా, yes, yes, something or that abnormal position, or they sleep like this because bed is small and four people are sleeping in a single bed, they sleep like this. Many fathers especially with young kids, they end up sleeping in this much one corner of the bed, and morning we get up with neck pains. I have experienced that. So these are the things which, if you correct, it's such a very simple thing, because painkillers are temporary. I'll give you a painkiller now, it'll be okay, but you go back to sleep tomorrow, and tomorrow morning atle untundi malli. So this is second part of sleep hygiene. How you sleep, your pillow, your mattress, how many people are sleeping with you, how are you sleeping and all. So these things have to be corrected.
Okay.
Then third is that how much time you take, right? So 5 hours, 6 hours, 8 hours, see, it depends on people to people. Many people, I think 8 hours, 7 to 8 hours is fine. As age progresses, your requirement to sleep goes down. Younger people might require 8 to 9. Above 40s, maybe 7, 6 is also okay. Beyond 60s, people get up 4-5 hours lone, right?
True.
So time depends on the age.
Quality of sleep important అంటారు.
Yes. So that I asked, 8 hours పడుకున్న తర్వాత కూడా మనకి స్లీప్ ఎందుకు సరిపోవట్లేదు, హెడేక్ ఉంటుంది, డే టైమ్ స్లీప్నెస్ ఉంటుంది, ఎందుకు? సో క్వాలిటీ ఆఫ్ స్లీప్లో వన్ వెరీ మేజర్ ఫ్యాక్టర్ ఈస్ స్లీప్ యాప్నియా అంటారు. స్నోరింగ్ బేసిక్లీ, యూ మస్ట్ హవ్ హర్డ్. సో స్నోరింగ్ కాజెస్ your airflow ఉంటుంది కదా, when you sleep your airflow gets obstructed because of your windpipe gets collapsed. అది కొలాప్స్ అయినప్పుడు airflow gets obstructed. దానివల్ల ఏమవుతుందంటే ఆక్సిజన్ ఫ్లో తగ్గుతుంది. సో వాట్ హ్యాపెన్స్ ఇస్ స్లోలీ ఆక్సిజన్ తగ్గుకుంటూ పోతుంది, అండ్ సడన్లీ ఇట్ విల్ గో సో లో దట్ యువర్ బాడీ
automatically wakes you up. Oxygen
right?
saripokunda.
But you will not remember that.
True.
So that is called apnea. So you have multiple apnea this thing
Episodes
overnight. So then you keep waking up, you don't remember, but what exactly happened is your deep sleep gets destroyed. You're not able to have enough deep sleep. దానివల్ల ఏమవుతుందంటే your quality of sleep is not enough. That is when you feel tired and insufficient sleep at night. So sleeping is not enough. Having good amount of deep sleep. Now, why is it important to have a good sleep? Deep sleep. So what exactly happens is there's something called glymphatics.
Okay.
Glymphatics అనే ఒక వర్డ్ ఉంటుంది. So when you sleep at night, these glymphatic channels get activated and they clean the brain.
Okay.
Of the impurities or whatever byproducts were accumulated over day for your normal activity. దాన్ని glymphatics అంటారు. And they're most active at night. So if you don't have good deep sleep, your glymphatics don't clean your brain, and that's when more and more abnormal proteins or damaged proteins are accumulated.
Okay.
Okay, so that's how you develop slowly neurodegeneration.
Okay.
As this
This is the-
progresses,
Uh-huh.
chronic lack of long-term lack of sleep causes glymphatic abnormality or dysfunction that causes abnormal accumulation of
Protein.
dead proteins or abnormal proteins, and that causes dementia.
Okay.
So this is one of the factors which leads to dementia, Parkinson, all these things.
Mm-hmm.
So this is why, apart from other stroke and heart attacks which caused by metabolic effects, this is a very major thing. People who sleep well, sleep on time, get up on time, and have a good sleep, have much better cognitive function later in their life. So, right? So this is glymphatics is a new terminology which has come in the last 5 to 6 years has come up. And it's very, I told you, it's like a kitchen, cleaning a kitchen. If you don't clean a kitchen in the night, and that keeps on going night and night and night, how will your kitchen be after 10 days or 1 month? What will happen?
We cannot sit, yeah.
You cannot cook there.
Yeah.
So this is exactly what it is. The brain needs to be cleaned. Unless you do that, the sustainability comes in here. చెప్పే కదా ఏం చేసినా సస్టైనబుల్ ఉండాలని. You don't sleep 5 to 6 years down the line, you are not functioning well, you're not productive, you're not doing your work correctly, and you lose your job.
ట్రూ. సో మీరు ఇందాక మాట్లాడేటప్పుడు పిల్లో గురించి మాట్లాడారు కదా, మీ దగ్గరకు ఒక పేషెంట్ నెక్ పెయిన్ ఉంది అని వస్తే వాట్ డూ యూ సజెస్ట్? పిల్లో వేసుకోమన్నా వేసుకోవద్దన్న ఆ డౌట్ కూడా చాలా మందిలో
So
ఉంటుంది.
I was about to talk about it actually. So this is a very common scenario where patient comes with neck pain for a long time, and they are not using pillow because someone told them don't use a pillow, right? So see, it is very simple. Your neck is, your head is here, your shoulder is here. If you sleep on one side, this is a big gap here. If you don't use a pillow, you'll sleep like this. And if you sleep like this whole night, already it is paining for me for a few seconds. How can you not have pain? Definitely you have pain in the night. In the morning if you sleep like this. So pillow has to be used.
Okay.
So what size? That depends on person to person. So there's such simple, minute things. Your pillow thickness or your pillow softness, which is comfortable to you, depends on your mattress.
Okay.
You use a very soft mattress, your body sinks into it, right? And your neck and your shoulder and your head come to almost same level. So you need a smaller pillow.
Okay.
You're sleeping on a firm mattress, your shoulder does not sink into the bed. So your shoulder and the gap between this is much more than soft mattress. So you need a bigger pillow.
Okay.
So now that is just small things, because I tell you use this medium sized pillow. They're sleeping on a very firm. Some people, old people, sleep on firm mattresses. It will not be enough. And you're sleeping on a very soft mattress. You use a big pillow, it will become like ulta, the other way around. So I always tell them, see, you sleep and see whichever size pillow is comfortable to you. But pillow also again should be a little firm. Usually these sponge pillows come, they are not very good.
Okay.
Because they look this much, but when you sleep they become this much.
True.
Right? So that becomes a problem. So you need to use a nice cotton rui wala pillow, you say, that firm one, medium size pillow, and you should sleep and see which is making you comfortable.
Okay.
So these are which I cannot tell because it depends on
small
person
things,
to
but
person.
yeah.
Yes, depends on person to person. For మీరు మేల్స్ ఉంటారు, broad shoulders ఉంటాయి, they might need a bigger pillow.
Okay.
Females
All
who
these
narrow
matters.
shoulders, they might require a smaller pillow. So when you're sleeping on one side, you should have a good pillow. When you're sleeping straight, the pillow should not be too big, otherwise your neck will become like this. So that comfort of pillow is very important.
And that somewhere or the other, it helps you for your proper sleep also, quality of sleep kuda
Definitely.
dani
Otherwise,
valla.
if you're having pain, many people say పడుకోగానే నొప్పి మొదలవుతుందని. దాంట్లో డాక్టర్ అవసరం ఏముంది, మీకే తెలుసు ఆ విషయం కదా. It is very clear that it is your pillow problem. And then obviously you'll have neck pain.
True.
Same thing happens with back. You use nowadays, before when we were kids, we never had these spring mattresses, soft mattresses. We had normal mattresses. So no one knew what back pain is. First time when in Delhi 2016 we got one mattress. It was a little soft. First time we bought a spring mattress.
Okay.
Immediately I started having back pain. At that time I also didn't know why I'm having a back pain. So when you change a mattress, it's too soft, your body sinks in, and your back is like this instead of being straight. You will have pain. So your sleeping surface is very important. Some people are comfortable sleeping on floor or sleeping on stools. That is their if you're used to it, that's okay. There's no single answer to it.
Okay.
It is, only thing is whatever makes you comfortable, don't change suddenly. Because many times we go to a hotel, come back with a stiff back. Why? Because the bed has been changed. So that has to be taken care by the patient themselves to be comfortable.
Okay. Thank you. Thank you so much for your insights.
Thank you.